Acupuncturist. Hi everyone, good morning. Okay. Good morning, good morning. Welcome to Center of Balance Live. I'm Sunan Phua from Center of Balance, the acupuncturist. Now, today's topic is about acupressure point for fibroids treatment. Hi, happy day, how are you? So, acupressure point for fibroids treatment. That's what we're going to talk about today. Now, we talk about acupuncture strategy and Chinese herbs for fibroid treatment, right? Now, today we're going to talk about acupressure point. Now, the acupressure point is a bit different with acupuncture because when it comes to acupuncture, you really have an acupuncturist to set up the strategy, the acupuncture protocol for you, right? And when it's actually individually tailor-made the herbs and acupuncture formula, acupuncture point formula for you to suit your individual conditions, right? Then, therefore, however, when it comes to acupressure point, you kind of know you don't have an acupuncturist to sit there and talk to you and then give you some idea and to change the point for you. So when it comes to acupressure point, we choose the point that no matter what type of conditions and what type of fibroid you suffer from, or what kind of condition individual body that you are, and we're going to set up some point that is a general point that suits for all of the fibroids. So which means any type of fibroids that you suffer from, then it's going to work for you. Does it make sense? But there's no point for me to set up an acupressure point formula for you and then to tell you if you have this type of fibroids and you do this, if you have this type of fibroid you do this, if you have this type of fibroid you do this. Now there's no way for me to say that. Okay, all right. Now, hi Veronica, nice to see you. Thank you. And Eric, thank you for being here and supporting me. Thank you very, very much. All right, then let's start then. The acupressure point, all right? I'm very good, thank you. Happy day. Now, if you are in this live video, please say hello to me and then give me a thumbs up and share this video. Share this live video in your social media. If you're on Facebook, share on your Facebook page. If you're on Instagram, please share with anyone that you know might need this information. Right? Thank you very much. Okay, the acupressure point, the general one, we want some points that are treating all the organs. So I repeat that again and again and again in many disease, many topic when it comes to acupressure point, which is 3-1-2 at meridian method, right? So that is from Master Zhu from Beijing. He I think he's over 100 years old now, and those points, when I discovered those points and I teach my patient to do that, and I actually read all the material that available online, and a lot of people use this only 3 points that acupuncture point to lower blood pressure, cholesterol, and blood sugar, and many other disease, and balance hormones. Balance hormones means a lot of pain as well, and emotional issues when it comes to menopause. Okay, when it comes to menopause, so those 3 points are a key point to balance all organs. So I'm not setting out and take a pulse and see, oh, hey, you have your lung and large intestine out of balance, and you should use this point, this point. Doesn't matter. When it comes to acupressure point, you don't have an acupuncturist, and I can't check your pulse, I can't collect all the information, but hey, just do this 3 points, because those 3 points will balance all organs. Doesn't matter which organs are out of balance, which means it's not focused on certain organs, but it is actually work for all the organs. Okay, so to be honest, I suggest all my patients to do this 3 point daily. When I found that if my patient, of course, not everyone listen, not everyone practices daily. Right? I do practice it daily myself, and all my patients, if those are practicing this acupressure point, and you will see the results is lasting for longer, and as well as the results speed up very, very fast. So believe it or not, you tried it yourself, and you try it on your patient, okay, and you get your patient to do it, and you ask your patient whether they do it or not if you're a practitioner, and if they do it properly, then that's how, and compare with the others that are not doing it, and you compare with it, and you'll see that the results speed up very, very fast. Or if those hasn't been doing it, you encourage them and remind them to do it, and once they start to do it, you find, wow, when our treatment comes to one point that it can't go any further, when they start to do a daily exercise of acupressure point, then you find, wow, suddenly the next week they come back, things that improve a lot. Hi Laomi, how are you? Thank you for being here. Alright, here's the point. The first point is Hergu. Now, because I repeat it again and again, then I know what Hergu point in the English code is called. Large intestine 4, right? It's over here, right? This is the first point. So use your if you're not an acupuncturist and you don't know where it is, so put your thumb closer to your index fingers where the highest point is, right? This is Hergu. This is a very good point, and large intestine meridian. So, or you use the crease over here and to match here and to do this. So have you done this yet? If you've been following me on the video, and have you done this today yet? If you haven't, now is the best time to do this. Okay, so people do this. Like I have another patient come in yesterday, and I asked her, have you done the acupressure point? Yes, I have done it. And she showed me how she did it, and she just do it this way. I said, wow, that's great, you got the right point, but if you try on this, grab it like this, and you put on here, on this position, and grab it like this, which one's more stronger? You'll find this one more stronger, especially when you dig it to the bone, right? It's much easier to do the acupressure point, okay? So my suggestion is do it for 1 minute each point. Alright, so Hergu point is just one, but if you know the holographic theory, so you do it from here, so it's large intestine 3, from 3, 4, move toward to here, from here 3, move toward to here, right? So get the most sensitive one. So you get 1, 2, press 3. Like my one, I only feel a little bit in here, but you may feel a lot of, because I do it every day. I dig it and do acupressure every day. So in here, so that's a bit more sensitive, so I do this. I can do this for about a minute. So make sure you do it down here. So most of the time you get very sensitive in here or in the bottom in here, right? It can be in here, but anyway, I don't know which point is going to be sensitive for you, but any point along here, when it's sensitive, do it for 1 minute. Okay, do it for 1 minute. I want to tell you that this is very good point for any pain. So if you have tummy pain, fibroid cause any pain, do this. Okay. Now second point is PC6, which is 内关, okay, PC6 内关. So over here, so 3 fingers from the wrist here, right, and 1, 2, 3, and lower 1 level and up 1 level, 1, 2, 3. So 3 fingers in this level, above 1 level and below 1 level. There's 3 level, 1, 2, 3. So 3 level, right? You go for 1 in the middle, side, 2, 3. 1, 2, 3. In each level you have 3 points. 1, 2, 3. Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. And how do you do that? Use a knuckle to detect any sensitive point. You want to dig deeper, right? I want to let you know, if you do it in the middle, it's between 2 tendons. Between 2 tendons, if you dig it deeper, you may get sensation up down to your fingers, okay? Because there's a nerve in there, right? So this is another point that I suggest all my patients to do. It's not 九宫八卦, 9宫内关, okay? 9宫内关, 九宫内关. 9宫 is from Law School, okay? It's got a image in there. A very effective for stomach pain as well, and for nausea, and for stomach pain, and for acid reflux, okay? And it can treat a lot of things that over here, 3 points that you cover. It can treat all the organs, and all those 3 points over here, 9 point over here, and you work it out which one sensitive. For those that are not sensitive, you dig it in. No sensitive, forget about it. Only focus on those sensitive points. All right, and when you got to the sensitive point, keep digging, keep massage for about 1 minute. That's it. So simple. Okay, so simple. Now the next one is over here. So below your knee, that's in the external side, the internal side, there's knee eyes. So there's hollow. There's hollow below your kneecap. There's a hollow. External one and internal one. The external one means on the pinky side. All right. The internal one means on your big toe side. Okay. So on the pinky side, the hollow, 4 finger below that. Then when the 4 finger below that, and that is shin bone, right? And 1 finger out of the shin bone. So you go around that and get the most sensitive point again. When you get the most sensitive point, do it for 1 minute. That is stomach 36, 足三里. It gives you a lot of energy for that. Okay. Now apart from that, doing 2 legs exercise, or go for walk, or do squash exercise for how long? I suggest you do it for 10, 20 or 30 times. Okay, we have video for that, but you can do that. You can do it on search online. So 2 legs exercise is important. Right, left and right. Okay, you can do both sides. Or only you can do both sides. Okay, or you can just do one side, alternate it every day. Because I want to tell you that, I want to let you know, a lot of people do it too hard. They think the harder the better. Okay, and when they do it very hard, in the next morning, and the next time they want to do it, oh, it's too painful, they can't do it. If that happens, hey, you do it, you overdo it, and just put a heat pack on, and you do it alternate side. Okay, so you can do both sides together, and then that's fine. But when you do both sides together, that take up more time. So take it easy, just do one side. Once in here, tomorrow, and that side, the next day, the next another side. So do alternate it. So this is not this is a treatment that can maintain your body situation. It can maintain your organs function. All right. So once you increase the organ function, a lot of things will change. The hormone will be balanced, and the pain will decrease in fibroids treatments. Does it make sense to you? So this is something that it actually cover all the organs for fibroids. So but apart from that, what can we do to the fibroid symptoms? So what sort of fibroid symptoms are we talking about? Well, the bleeding. Bleeding is one of the biggest symptoms for, and pain, right? Pain and bleeding. So those 3 points, it may cover the pain, but not necessarily. They are more powerful point for pain from causing from fibroids as well. Let me show you something over here. The acupressure point. This is spleen 6, 三阴交. Okay, 三阴交. 三阴交 over here are very good for fibroids pain. And how do you do that? For is this on both sides? Yeah, happy day. I just so I didn't see your question. It can be on both sides. It can be on just one side. Right? If you have pain on those conditions, and you can do both sides. If you just have fibroid and the silent fibroids, which means silent fibroids has been you haven't got any obvious symptoms. You need only have a diagnosis from your doctor that when they did ultrasound, say, oh, okay, you have a fibroid, you have few fibroids in there, but it didn't actually cause any things, any conditions for you, no discomfort at all. So you just do those points. But alternative, here are the points that spleen 6 very good. So 4 fingers from the ankle bone on top of that. So you do what? Just right beside the behind the shin bone, next to the shin bone, and you go for it, and you press the point. You do an acupressure point for 1 minute and up to 2 minutes. And my suggestion is, don't just do 1 point. If you want to get rid of pain, you want to help the pain, go for kidney meridian, spleen meridian, as well as liver meridian. If you're an acupuncturist, you know what I'm talking about. But if you're not an acupuncturist, here you go. So 1 point, 4 fingers above there, and around that you get the a point, and you go on top of the shin bone here. You press on it. There's no muscle, it's just bone, and you find it if there is any sensitive point. And you go behind the shin bone. There's 1 point very sensitive. There's spleen 6, and you keep going back to the calf area in here, and that is on kidney meridian. So from 1, 2, 3, right? Keep going there. Keep going and press on at any point from the front to the back here. From the front to the back here. If you can find, if you can detect any sensitive point, do it for 1 minute. And alternate it. I want you to do this from the 3, 4 finger here in the level, go down to the ankle. Cover all this area, right? You may find just spleen 6, it will get rid of the pain, but some pain still there because what happened in here, there are a lot of different meridian involved, and spleen 6 only able to cover the spleen meridian and stomach meridian pain. Most of the time it will cover very well, but it doesn't actually cover if the pain in your groin over here, and if it involved with a liver meridian, or it involved with kidney meridian, it doesn't really cover very well. And if you do all the point, all the meridian over here, and they cover all the meridian, and they get rid of the pain instantly. But when I say get rid of the pain, it doesn't mean one off. We expect it come back again. So you do it daily, or whenever it's painful, you do it again. Does that make sense to you? Right, I hope it does. Alright. Again, what else? What else can we do? What are the points? Now, if you have moxie button stick, you know, it's very good stuff, and you can do it over here too. And the moxie button can do it in here. One thing that I want to show you, that moxie button if on the tummy or heat pack on the tummy, it may not be good when it's bleeding. And how do you know it's good or not? Try it. If it causes more bleeding, don't do it. If it doesn't, it actually help with stopping the bleeding with moxibustion, then keep doing it. You just need to take test it, experience it, right? And another one, moxibustion in here. Moxibustion in the tummy is 5 fingers below your belly button. It's Guan point, on the Guan point. And moxibustion, you don't directly put on the skin. You can do it this and up and down. Just gets warm sensation. That's it. And when it's bleeding, a lot of bleeding, there are 2 points that I will suggest you to do moxibustion. You don't do acupressure point, you do moxibustion. Yes, you want to do acupressure point, that's okay too, on the feet, on the big toes one, alright? Big toes, big toe, there are 2 points. And on top of your head, Bai Hui 220, that's 1 point of that, right? Okay, over here, Bai Hui is both ear on the top, and from the yin tang, or in the middle of your head over here, forehead, and go up there, that's Bai Hui point. And cut a ginger, get a ginger about that thick, and then make some hole on it, use forks, make some hole on one side, and turn on the other side, and make some more holes in it. And then you put it on top of your Bai Hui, and get the moxibustion stick, light on, and put it on top of the Bai Hui 220, and burn it. Not actually burn it. Do not directly touch the ginger. The ginger in here is, if you get the heat go through the ginger, it actually create more heat, more warming. Okay, it comes with a warming sensation in there, and it works even better. And the ginger in there is try to stop you burn the hair, right? It helps a lot. So you push it on, put the ginger in with a hole on it, and push it in. So push it and close it to the scalp, so it won't burn your when you put moxibustion on top, it won't burn hairs. Okay, so keep doing this until the patient feel, oh, it's getting warm. Okay, and I suggest this for about 5 minutes, at least 5 minutes. And it's very good to stop, to get the energy, to hold the energy up, so, and stop bleeding. So that's one of the things that I do for my patient when they're bleeding a lot, or I show them how to do it and get their partner to do it daily. Okay, this is important. And what else can we do? And what can do for this? This is very good for miscarriage. If people have women who suffer from miscarriage and they're bleeding, do it. And that's very good for prevent miscarriage, and as well as hemorrhoid. I don't know whether you know about this. In hemorrhoid, there are 2 things that cause hemorrhoid. One is constipation. There is most case in constipation, but there are some case that is actually come with diarrhea. They go for diarrhea, too much diarrhea daily, too many, too often, then causing hemorrhoid. We're talking about external hemorrhoid. Or yes, internal hemorrhoid and bleeding a lot, you can do that. So it got a lot of diarrhea. Okay, and with diarrhea, you do this moxibustion on top of your head. Or in the acupuncturist, then I'm going to introduce 220, 12 magical point, 12 magical, like Bai Hui 12 needle on Bai Hui. So your needle, you treat all the organs, then plus ginger on and do this. And this is very good for all, lift up all the organs energy and stop bleeding and stop decrease or stop diarrhea, the water retard on loose time. Okay, this is very, very important, very important to do this. I've done this for my patient for diarrhea causing external hemorrhoid. It's so painful for her, and I did that with 1 or 2 sessions, and the pain basically gone, and the diarrhea stopped. So it's very, very powerful, and I do recommend that you do this if you have patients with diarrhea, with hemorrhoid, painful hemorrhoid, or bleeding, any type of bleeding, and not just fibroids, but fibroids does make bleed, cause bleeding. Okay, this is one of the things that I would add on when I do acupuncture. Okay, what else? Okay, here 2 points here. I think it's spleen 1 and liver 1. 硬白跟大敦. I'm not quite sure what is it. The English should be spleen 1 and liver 1, right? Yes, I'm pretty sure because it's kidney 1. Okay, so you do on basically the 硬白 spleen 1 is the best point, but we found that the 大敦 is actually been written on the textbook, and we use both. And with those both, it's very good for they are very good for bleeding. Okay, so moxibustion on those 2 points, and those 2 points will be in here, just on the side of the nail, fingernail, toes nail. Okay, if that is the nail of your toe, on the side, on both sides, here and here. So you can do pressing acupressure point using your fingernail, and press on the toe nail beside it on those 2 points. You give it about 60 times, to press it about 60 times, and it help. Or moxibustion on those points. Again, moxibustion for 5 minutes, 5 minutes. Moxibustion, you need to take long, about enough stimulation for about 5 minutes. Okay, an acupressure point, normally I suggest 1 minute or 2 minutes. Okay, you can do 5 minutes if you want to. Okay, those are the acupressure point for fibroid treatment. So first we have 3. Let's get a conclusion. The first, we have 3 major points. Large intestine 4, which is in here, you do acupressure. We do spleen, pericardium 6, you have 9 points in here actually. Okay, Chiogong, pericardium 6. The second and third, you got Jushan Li, stomach 36, right? And apart from that, it's very painful. If it's those 3 points are for all the organs, balance all the organs, get better function on all the organs. Okay. Then for the fibroid symptoms, painful, bleeding, especially for painful, you do spleen 6, right here, and cover all 3 meridians here, and get acupressure point around this area. From spleen 6 to ankle, right? Cover everything. Then this is the 4th, 5th, and you do you can do moxibustion on spleen 6 as well. And 5th, you do Guanyuan, 5 fingers below belly button, and use moxibustion. Okay, 5. And number 6, you use Bai Hui, moxibustion. Okay, you don't do acupressure point here. Moxibustion with ginger. 6, 7, you do spleen 1, and 8, you do liver 1. Okay, so 8 different acupressure point that for you. Some of them with moxibustion, some of them just using your hand and press it, right? And the last 3 one, like Bai Hui and liver 1 and spleen 1, they are very good, effective for bleeding. Okay, so there's something that you can do at home. Alright. Then apart from that, I suggest you do see an acupuncturist if you're a patient, and if you need Chinese herbs, you can take Chinese herbs. If there is no condition at all, like no bleeding, no pain, and you want to get rid of it, you worry that it get bigger, that is something that you can do at home and get regular acupuncture and to start out the hormone, then it will shrink down, right? It's possible, and even possible that it may pass out. Or you can just do this treatment at home yourself, and when it lead up to period time, the bleeding time, then you get acupuncture to help it pass out. Not every of the fibroid will be able to pass it out. You need to see your Chinese doctor and acupuncture to discuss which type can pass out when it comes period. Okay, it's possible. Okay, alright, that's it for today, and please give me a thumbs up if you like this video, and I'll see you tomorrow morning again, 7 o'clock or 7 something that we're gonna go live. It's about half an hour now, so I have to go now. So thank you for being here and supporting me, and I hope you enjoyed this live video. This is about acupressure point, and I hope that give you some idea what to treat even the acupuncturist. Thank you, Veronica. Right, this is it for today. Stay awesome, and I love you all. See you tomorrow. All right.